Hello again, this is Dr. Keith Castle of Contemporary Chiropractic. Today what I want to talk to you about is different variations of segmental adjusting which are available at Contemporary Chiropractic. Now to start with, I'm going to cover toggle recoil. Toggle recoil is a technique which is addressing the very important first vertebra in your neck. This represents the base of your skull. That hole is called the foramen magnum. Now your brain actually extends through that and into the first vertebra in your neck, which also has a very large hole in. So your brainstem actually extends into your cervical vertebra while you're alive. So this position between the base of the skull and this first vertebra is very important to a lot of different things, particularly things like cerebral spinal fluid. And a chiropractor that addresses this can do you a lot of good in a whole bunch of areas. So the way the adjustments are normally done on this is we're going to do some very careful x-rays, so we're going to find out which direction that bone has moved. Then we're going to specifically put the patient in a side posture so that we have that bone in the ideal position to actually adjust it. And the way the adjustment is done on that is it's a very fast adjustment, and he's going to, the chiropractor will contact you like this, and he's going to come in and he'll actually pull his hands off of your neck in a very quick motion like that to adjust you. Alright, when he has that thing set and is set in the right position, it's like rebooting your brain. It's a very powerful adjustment. Now, the most common type of segmental work that's done by chiropractors is called diversified. It is a collection of a whole bunch of different kinds of adjustments from a whole bunch of different techniques, some of them named, some of them unnamed. You'll see things like rib adjustments in that. You'll see thumb contacts with adjustments like that. You'll see side posture with that. It's basically the various adjustments are very common with in all the different chiropractic offices. Now, I'm going to go over Thompson drop work next. Thompson drop work requires a table that has drop pieces. This one is going to have a pelvic drop piece here, but a lot of times you're going to have a lumbar, you're going to have a thoracic, and you're going to have a cervical drop on. For our purposes, we're just going to use the pelvic drop piece. Now, in Thompson work, one of the critical things that's done is you do leg checks. In this particular case, we actually do have a little bit of problem, so you're going to get to actually see a real adjustment. So you bring that up, and this tells me that her pelvis is brought back in this direction. So the table is cocked up in this fashion, and the patient is contacted. These heavy bones have a lot of weight to them. So I'm going to put a pressure on them, and the table will stop suddenly. And when it stops, the weight of the bone will actually cause the joint to move. That's the inertia. That's how that one works. All right, another type of technique that we do at Contemporary Chiropractic, you're just going to have to imagine this one because this table doesn't do it, is we do what's called Cox flexion distraction, which is a specific technique that's used for lumbar disc problems. And on that one, the back end of the table actually is able to move down and come back up, and it does that automatically. And what happens is the doctor will contact the vertebra above where the disc problem is, and he'll hold it, he'll distract it up like this while the table's going up and down, and that will nourish the disc. And that's a great way to start getting these patients with these bulged discs where they're more comfortable, so then we can move on to other type of adjusting, because they really can't handle real side posture adjusting at that point. So you want to do the Cox flexion distraction first. Another kind of technique that we use at the office is Gonstead. Now, Gonstead can be done in all areas of the spine. The only one that we're going to be doing in our office will be cervical adjusting. Go ahead and sit up for me. Go ahead and sit right on the edge of the table. This is a type of adjusting that's done in the neck where the neck is contacted like this and it's brought over and it thrusts straight in like this. This is a little bit more of an aggressive type of adjusting. You actually are going to adjust through the little facet joints in the back, and this is the idea of Gonstead, is to affect the disc. This is a deeper type of adjusting. Some patients find this is the only kind that actually works for them, so I recommend everyone at least give it a try. Okay, go ahead and lay face down. Another type of technique that you can get done at Contemporary Chiropractic is you can get SOT work. SOT work is really about realigning the pelvis down here with no force. So if you have a patient whose hip is dramatically back this direction on this side, one of the things that would be common on a patient like that was you would block the bottom of it on this side and block the top on the opposite side, and that will allow the pelvis to drop forward on this side and drop back on this one. Now there's also some maneuvers that are done while they're in that position, but basically you get them on the blocks and you allow their breathing to actually cause the actual changes that are going on there. Now, we also do extremity adjusting in the clinic. Go ahead and sit up for me. Sit on the edge of the table. Extremity adjustments are done in all the extremities. We do work in the wrist for carpal tunnels. We do work in the elbows for things like tennis elbow. We work on shoulders. We work on hips, knees, and feet. So all the areas of the body, all the articulations of the body can be adjusted, and they're all adjusted at Contemporary Chiropractic. All right, go ahead. Now, the last segmental one I want to demonstrate is activator. Now this is an activator. This is an instrument that can be used to do adjusting. Now you might have seen these in a chiropractor's office before. That is actually the adjustment. Now what I want you to do is we're going to zoom in the camera so that you can see that on this skull right now we have a situation where the teeth don't align. That's a little bit of malocclusion. Here's the activator. Now watch what happens to the teeth when I actually use the activator on it. You see the way that bounced back in place? Most people think that an activator doesn't really do much, but I assure you this is a very powerful adjusting technique in the hands of a skilled chiropractor. Well, that's it for the segmental types of adjustment that are available at Contemporary Chiropractic. I hope that helps you in your decision-making process. This is Dr. Keith Castello, wishing you guys have a great day. Thanks a lot.